Well, have you ever received a medical bill that you were not expecting, or even worse, a bill that you couldn't afford?
A CBS News analysis of IRS data found many nonprofit hospitals here and across the country attempt to collect hundreds of millions of dollars a year from low-income patients. Investigative reporter Liz Crawford joins us now.
Well, all of the nonprofit hospitals in our area, that's the majority of them, and they receive huge tax breaks, federal, state, and local. And in exchange, nonprofit hospitals are required to provide free or discounted care to those who can't afford to pay. But our investigation found that law is vague, and some patients may be falling through the cracks. This is how most days start for Denise Costa-Mudre. Every step is a struggle. She's off to her job as a cafeteria lunch aide at the middle school in Stratford, New Jersey, a job Costa-Mudre says helps her pay off medical bills.
Kind of told them you can't get blood from a stone.
In 2022, Costa-Mudre says she went in for a follow-up surgery at Jefferson Hospital after a knee replacement at a different facility, but still struggles to walk. She says the bill was higher than expected because there was a complication and she was put in a medically induced coma for 2 weeks.
They took the tube out and then they told me everything that happened. And I was just in shock.
Costa-Mudre, who's on Social Security disability and Medicare for insurance, is still getting bills for that hospital stay. She agreed to tell me more about her situation at her relative's home.
When I got the bills, I was like, oh, how am I going to do this?
Costa-Mudre, who struggles financially, says she was able to work out monthly payments with collection agencies who take over the debt of healthcare systems so she can get by. But some patients are worse off than her. The CBS data team looked at the latest numbers available. On a 2022 tax form in a section for bad debt expense, Jefferson says it sent bills totaling nearly $8.5 million to patients who were, quote, eligible under the organization's financial assistance policy.
To those of us who look at this, it's hard to distinguish the behavior of nonprofit and for-profit hospitals in many dimensions.
Dr. Vikas Sani is with the Lawn Institute, a research organization for healthcare. Federal law requires nonprofit hospitals to provide, quote, sufficient community benefits and a written financial assistance policy in exchange for those big tax breaks. However, the law does not specify what exactly establishes sufficient community benefits.
When nonprofit hospitals behave like for-profits, the community is not really getting their side of that bargain.
According to that 2022 tax form, Jefferson details its financial assistance policy, saying in part, a patient may qualify for discounts on medical care if there is no health insurance available or has health insurance, but that insurance does not fully cover the medical care needed. We found the policy online and on Costa-Mudre's bills.
It says you may be eligible for their financial assistance. Have you ever tried to?
Yeah, that's their financial assistance. Is they said, what can you pay a month? And I said, well, how about $10 a month? And they took it.
In a statement to CBS News Philadelphia, a Jefferson spokesperson said there are no active balances associated with Costa-Mudre and, quote, while the patient did not qualify for presumptive exemption at the time services were rendered, we cannot retroactively determine if she would have qualified for financial assistance. Despite being guided on the process, the patient never completed a financial assistance application. When patients can't pay, it causes financial strain for many organizations.
When people can't afford care, they can't pay for it. But there's a question about where the money's supposed to come from.
Jill Horwitz, a law professor at UCLA with an expertise in nonprofit health policy, says nonprofit hospitals offer much more than just discounted health care for the low-income population. They're more likely to have emergency departments, psychiatric wards, and drug rehabs. Services, she says, are known to be vital, but not profitable.
The ordinary nonprofit hospital in America in a given year operates at a negative operating margin. There is no money tree.
A spokesperson for Jefferson emailed, Jefferson Health is dedicated to providing exceptional care to every member of our community, regardless of their ability to pay. Through our financial assistance program, we offer support to patients who are uninsured
underinsured, ineligible for government assistance, or otherwise unable to afford medically necessary or emergency healthcare services based on their individual financial circumstances.
Now, Horwitz and other experts agree the entire healthcare system needs an overhaul. She just believes the fix needs to come from Washington, not community hospitals. Now, if you're having trouble paying medical bills, start by looking up the hospital's financial assistance policy, see if that could help and what payment options might be available to you. So every hospital's different, every circumstance is different. The best thing you can do, though, is try to look for that policy.
You may have
So
a lot of people
complicated.
reaching out to you.
Yeah,
for help.
seriously.
It's a big problem.
Well, thank you.
Thank you, Liz.